Yeah, well, one of the things that we try and do just to set the stage a bit is make sure that individuals coming in are feeling as comfortable as they can. We just acknowledge that there are lots of fears coming into a program, so we want to make sure ahead of time that they know exactly what the plan is and the routine and what they can bring forward as issues and talk with us about, and really lower the barriers again for their recovery, and also to educate them very upfront about what are the issues that you're going to deal with. There's going to be some medical issues you're going to deal with right up front, fluid retention and hot flashes and things like that as your metabolism starts coming up. And so they're not aware of these things, and you want to set the stage early for them so they know exactly what to anticipate, going forward. But then, so what we do is we educate them, but then in the typical day, they would get up in the morning. They have a prescribed time, for getting up. We give a little leeway on that sometimes for those because not everybody is super early morning person, and others are very early. So, they get up in the morning, they get ready, they shower, etc. They have their vital signs taken, very quickly, because we want those vital signs first thing in the morning before anything happens. We want then to have them, after they're ready, sit down and have a normal breakfast. We then begin programming for the day with individual psychotherapy, with group psychotherapy, process groups. There are family sessions that individuals get involved in, because the family is critically important to the work that we do with these individuals. They can identify how much sometimes they want that involvement, but we encourage them, because in order to get at the root of the eating disorder, you have to get at the root of what the problems really are. And frankly, if they are not wanting to involve the family, it makes you wonder what's happening there that could be furthering their eating disorder as well. So we encourage that a lot, and family therapy is a big part of what we do as well. In addition to the psychotherapy, and by the way, at the Oliver Pyatt Centers, we do daily psychotherapy on an individual basis with the patients, and that doesn't happen everywhere. A lot of places will do psychotherapy individually with patients, maximum of 2 times a week. So we find that it's critical to develop that therapeutic relationship with somebody, that being a primary therapist, who they can trust and have confidence in as they go forward to really deal with these issues. So individual psychotherapy is important every day, we feel. Then we have lunch, and lunches are typically monitored for support for the individual. We never make it a punitive process. We make sure that the individual knows that we are there to support them in their fight against their eating disorder. If they're doing something that requires a correction, you correct them without big attention to it. You don't want to make them stand out in a group or anything like that. We'll pull them aside, redirect them, and try and get them back on track that way. But all meals are monitored that way, by necessity. And then you have experiential outings and things where individuals who really are unable to go out into a setting with other people and go, just explore life and get a meal together or something like that. We have them go out. We have them do restaurant outings. We have them do clothes shopping, because clothes are a big trigger for individuals. We have them go to a swimming pool, try on a swimsuit, get used to the body image issues, and start dealing with those in a therapeutic way. Lots and lots of different things that we do with these individuals to try and put together a very therapeutic day for them.